Health is more than an absence of sickness. It often plays a major role in determining people's quality of life. From reducing the spread of illnesses and treating mental health issues, to providing access to safe drinking water and nutritious food, health encompasses a wide range of areas. However, even if individuals are healthy, the surrounding environmental and social factors around them can cause significant impacts. For instance, many around the world are denied equal access to resources and opportunities, often worsening health issues. To create a thrivable world, we must understand the factors that contribute to health issues and how they can be mitigated so everyone may live happy and healthy lives. That's why we've invited Dr. Roberto Azcui, a senior lecturer at Torrens University's Center for Healthy Sustainable Development, to present and take questions from the audience.
I must say that given such a significant part of what was shared here tonight is around thrivability and is about providing equal access to opportunities and the resources needed to survive and indeed, as we would say, thrive. So this presentation makes some valuable points about health inequalities in low-income countries. To this end, I'd like to thank Dr. Azcui for sharing his valuable knowledge and experience with us. After all, even the smallest actions in our homes, workplaces, communities make our world more thrivable. Step by step and drop by drop, as we say, everything we do can make a difference for our planet and our future. So I'd like to welcome everyone to the question and answer section of our webinar this evening. This is where you'll have the opportunity to ask questions directly to our speaker. And please do post your questions in the Zoom chat. And our colleagues will be passing those on to me so that we can forward it to our VIP guest speaker this evening, Dr. Azcui. So let's start with one particular question. So we spoke briefly before, and I know that you specialize in global and environmental health, infectious disease management, and public health policy. Also, you have extensive international experience, particularly across South America. So I wanted to ask you, I guess, during your work in rural communities, was there a particular patient or experience that fundamentally changed your perspective as a physician?
Thank you, Dr. Morris. An excellent question. Yes, I have. I even remember cases where talking about equity. For example, there was a case of a woman that has 5 or 6 children, and she suffered a stroke. Unfortunately, she was suffering from hypertension, very poorly managed hypertension, with a lot of that misinformation about what you should do. And I remember when she suffered the stroke, we needed to send her to the city, the hospital in the city to receive, of course, a specialized treatment. And they were very limited in resources. And I remember trying to find a way to fund at least the transport of the patient. The hospital has already agreed to take it without considering any payment at the time. And I remember a lot of the community members coming and offering them to use their own transport. But of course, we required ambulance transport given the condition. So the community started to raise money to transport the patient. So I remember that case that moved me in that way, looking at how the community come together. But at the same time, how having that limitation of resources, this poor woman with many children, young children, we're talking about, I think if I remember correctly, the oldest was 10 years old. And fighting this significant complication. Yeah, that was one of the cases that I remember very well.
I mean, welcome to share another case, if you will, because I think this gives a little bit of a flavor of some of the issues that in less developed nations, are being faced. I know I spent 20 years working in less developed countries and also familiar with greater struggles that come from there. So could you please maybe share another example or two?
Yes, this is another case. It was a baby with dehydration. Um, I remember she came late night because she was almost in a comatose state with a significant uh, with severe dehydration. Uh, of course, the parents were also limited in resources, but the main problem was the mother was more concerned about their other children left at home alone. And I found that that's very common. Probably you also have experienced that of the that kind of utilitarian approach that a lot of people put in place of yes, that baby requires help, but my concern is the rest, the majority of my family, and having to do that, having to choose, having to decide what to do, stay in the hospital. We were trying to make them stay at least during the night so we can treat, we can give all the treatment to the baby. Uh, and yeah, I think that was also very bad. Thankfully, we convinced her. I think she managed them to get someone to see the rest of the to take care of the children for the time that she was in the hospital. But yeah, that's something that I've seen in many occasions.
Mm, mm. So very true that it's very different than it is in the West, where there is much better infrastructure, much better support, and also knowledge about what may be going on, what could happen next, what are the next steps, and so forth. It's a real struggle in some of these developing nations, and a lot of the world is in developing nations. So you talked a little bit about having conversations with the community. You mentioned that in one of your slides, community engagement as such. As I guess I might say something like, involve people early and often, make them part of the analysis, part of the problem statement, as one would say, and then involve them part of the solution statement. Um, so I have a question here around how do you build trust with communities that may initially distrust healthcare systems or outside professionals? They might not even, believe in modern science, as one would say. How do you deal with that? What's your thoughts on that?
Oh, that's a very, very good question. Now, the first and probably the most important thing is always be honest with them. What is the capacity that you have to help them, but also we can use tools to help them to be part of the solution. And one of the first research approaches that I did is actually called participatory action research, where as part of the research, you take action, but the community where you are doing the research is not just the participants, but also the researchers. So you're kind of a co researcher with the community. And I found that very useful because it helps us them to understand what is the problem, but also what are the solutions that you are providing to them or you are offering to them. So in that sense, I found that that type of tools, what in this case are research methodology, helps to gain that trust that sometimes is very difficult. And I agree with that question. Sometimes it can take months, if not years, to gain that trust, and you can see that not always as a direct feedback, but with the data. When we see the incidence, the prevalence starting to decline, I think that's a very effective feedback that uh, help us to understand, yes, that community is uh, following is following our recommendations, what we are asking them to do, and improving their health.
Mm, mm. I know I've had experience um, where someone was ill and their first thought is, or their family first thought was to call in what we would call a witch doctor, a spiritual leader of sort, and to the point of shutting out or shunning out typical Western medicine and so forth. And unfortunately, that ended up with a very bad outcome. But this is not unusual, and this is something that we have to deal with as it happens. So that earlier sort of, as we say, community engagement, to just be there so that they would reach out, even if it's option B, would have probably given a totally different outcome in these sort of cases. So I appreciate your thoughts on that. We have a question here from one of our listeners, and it goes as follows. Let me try and share that with you. It says, in Africa, many pregnant women die due to negligence by health staff, denial of care to pregnant women in labor due to access to bed facilities. Have you encountered such situation in your practice in low-income countries? And how did you navigate that? And what will be your advice for health staff in low-income countries in relations to such issues? So I'm not sure whether this is something you can direct specifically for the African continent, but I think in general the question still stands. What's your thoughts on that, Dr. Azcui?
Thank you very much, and thank you, Anna, for that question. Yes, I haven't directly experienced that because um, when we did, and probably that's I mean that the case in many in many parts in Latin America, especially when there was a program from the Pan American Health Organization that was aiming to reduce child mortality, especially perinatal child mortality, and it was to train uh, kind of gulas that you use here in Australia as well, Claude, in order doulas to help the um, to go to the communities and assess the risk of the delivery. In case that the risk increases, they send those patients to a hospital, and we manage the deliveries as traditionally in a hospital will do, with all the equipments necessary and the specialist if was required. We were lucky that we have a, a obstetrician helping us, but we also, as physicians, deliver a lot of babies during my time working in the rural areas. The other, I think, useful strategy, and probably this might be different in Africa, but didn't really deny access because of bed facilities. I don't remember having that issue, uh, at least from my time working in this. That was about 2 years and a little bit more. Uh, but in terms of having the staff to help us, especially when you are working alone in a hospital and you only have a nurse and you have not just pregnant woman, but also you have other patients. Sometimes we have some complications. So one of the strategies, it was to get help from residents, from those students who were specializing in uh, different medical specialties, including obstetricians, to come, do a couple of months, gain the experience, use that experience in their career. And we did kind of a rotation cycle of different specialists, always trying to have an obstetrician insight. And that helped us to manage those patients better, not patients, but pregnant women that requires really the specialized care, and those that could be even treated in communities. Having the delivery in communities. So yeah, that was my experience, but maybe it's different because I know that Africa has more limitations in staff and, of course, uh, bed facilities or other facilities.
All right, thanks for that. Just to go into another question that we have here. What role do local healthcare workers now play in sustaining healthcare improvements after initial interventions? So the question here is talking about, is there ongoing follow-ups and support? So this is for healthcare workers uh, playing a role to improve after initial intervention.
Um, well, first, I think community healthcare workers plays uh, primordial role. I think that's one of the most important roles that they have. Is not just engagement of the communities that where they belong or they work, but also they are the bridge between the hospital and the community. That's one of the most important roles that they have. And to sustain the relationship, I feel that hospitals or the healthcare system in general should kind try to have a long-term strategy to encourage more members of communities to become healthcare uh, professionals or healthcare workers that most of the time require just short-term training, uh, because at the end, we'll and one of the things that we did at that time, given the limited resources that we have, it was training them in those diseases that were most significant affecting the communities. And then we start to build more and more different short courses, workshops to educate them how to recognize a patient with a particular disease, how to educate people with tuberculosis or at risk of tuberculosis, for example. And that will end up being part of the program of the Pan American Health Organization. One of the actions was actually to support these type of workshops, short courses that help us to build more knowledge in these healthcare workers.
Okay. Just interesting on that. So, I mean, given just following on from that, given I guess limited resources, what are some of the low cost or sort of grassroots sort of type of solutions that may have proved surprisingly effective? Sort of directions that could be given for a group that perhaps doesn't have access to all the resources and limited knowledge, but proved quite valuable. So surprisingly effective given the basic requirements that were needed to satisfy those. Do you have some examples of those?
Well, one of the surprisingly effective um, type of approaches was actually going to schools and educating children, and but not just to educate them, use them as vehicles of education to their parents. For example, sanitation and hygiene, wash, a very significant issue in rural areas. Giving that education, practicing in the schools, teaching the teachers how to educate them in washing hands, using soap, the importance of washing hands before preparing meals, and seeing that message going to their families. I think that was a very surprising uh, uh, action or solution that I found, and very effective. So sometimes we don't have to think that when we go to schools and we educate children, that message doesn't go through or the families, because found that that's uh, the opposite. Actually, they help us to expand that message.
That's good. So sometimes with simple direction,
Very
it's
simple,
possible.
not expensive. Uh, yeah, things that you you believe is not effective, but actually shows to be effective. Yeah,
Yep, yep, exactly. We have another question from an audience member. So I'll go across to this one. Since you have worked across different countries and regions, what major differences across regions, especially in terms of gender equality, you have come across? Was any given region that stood out to you? And also, there's a second part here. It says, with rising geopolitical tension and conflicts and economic instability across the world, how is this going to affect the different regions, and what your take is on handling this at the community level? Paraphrasing a little bit here, but I think you have the question in front of you if you like to study it a little bit better. But there's two questions in there. And please, if you can address one by one, that'll be great. Thanks.
sure, no problem. So for the first one, in terms of gender equality, um, at the time that I was working there, I think uh, yes, there was a clear inequality existing because the gender roles, particularly, we're talking about farmers, and traditionally farmers are male and female, or will is the one who takes care of the children, and of course you can see that with the when it comes to the education and the priorities that they have. The example that I was giving with the baby that was dehydrated, the mother was the mother was the one concern about the children, because the father was going to the field to farm, because if they don't farm, they don't have resources. They don't have a backup as many of people will have it. So you can see that woman was struggling to take the decision, because the men decide, I need to work. I need to go. The father, I need to work. I will not say that the father didn't care about the children, but that was the struggle that they have. So I've seen that very common in many areas, crossing borders even. Um, I don't think I will say more is that's a rural uh, concern, and where we see these inequities that exist and potentially still now today are affecting these areas. I haven't worked in those regions for a long time, but I don't think has a significant change. And with the geopolitical tension, I think these issues and the economic instability will continue to grow. And of course, you can add there climate change. I think that's more uh, one of the critical issues that will continue to create these inequities that exist, gender inequities, rural versus urban inequities. So yes, unfortunately, hopefully the stakeholders that work in this area realize that we need to change things there. And just to answer, what are your take to handle at the community level? Um, well, of course, with education, health literacy, and making people understand that the health of the individual and the family uh, is a role that both parents needs to consider. Um, it's a little bit difficult because a lot of these role uh, these gender roles are embedded in the culture, and that could also be a conflict that exists. Um, and I've found sometimes that we need to navigate that roles, identities that they have that is different than what we believe, unfortunately. Sometimes we have to consider that. Um, so yeah, but at community level, those strategies going to communities, engaging, as you can see from my photos, a lot of the attendees were actually women and children. So I think we were building something of knowledge that can be then transmitted and maybe can help with those gender, achieving a gender equality.
Mhm, mhm. And I agree. Having worked 20 years in Asia, the disproportionate sort of effect on women and children, especially, they're most disadvantaged. So I concur with a lot of the statements that you just made earlier on this. Okay, let's go to another question here. This is more looking from the government side of things. So, how can governments and policymakers better support physicians working in remote and rural areas? So, government and policymakers, what's your thoughts on that?
Well, that's a difficult, the bureaucratic barriers that we have. No, I believe that resources, of course, are always important, but I think probably um, going and engaging with the communities and knowing what they need. One of the tools that we use a lot in health promotion is actually needs assessment, where we go and understand what they need. And many of you probably have heard this is a very common uh, a very common story that we tell to students that happened in many, probably many countries, but now has become almost a training tool that we use, and is when you give something to the population that you believe they need, they they will that you believe it will be helpful for them, but actually they don't need it. For example, when you go, and I heard this a lot from peers that has worked in areas with vector-borne diseases. I remember a doctor telling me that they received from the government uh, mosquito nets, and they give to the communities, and the communities were using the mosquito nets to fish instead of using as a mosquito net. And that has been, I don't know what is the origin of that, but that has been transmitted as a example of when the government doesn't really understand the needs of the community. And if you go there and you understand what they need, you can provide better resources and be more efficient with the resources. So I think that is the most important thing, to talk with the community. Even it's simple, uh, probably the most inexpensive way to approach or to take action. But unfortunately, many policymakers and other stakeholders don't really do that. They are guided by uh, what they know, what they have read, what they believe the community needs, and not actually what they really need coming from there.
Yes, better understanding of what's going on and what the requirements are. That makes a lot more sense. Um, so, following on from that, there's a question here about funding and policy barriers. Um, so, if these were removed tomorrow, uh, what would be your first priority for transforming rural healthcare delivery? Obviously, a very broad statement here, but they're saying if funding and policy barriers were removed, what would be the sort of priorities in transforming healthcare for healthcare delivery in rural areas?
Well, actually, I think it will not be directly to health, but it will be to education. I feel that improving education is probably the first step uh, into early education, and helping them to reach higher levels of education at different different degrees, technical, university degrees. I think that's probably one of the most important actions to achieve equity. In fact, one of the strategies to reduce, for example, child mortality, and a lot of uh, professionals in public health know this, is to increase education, and particularly in women in rural areas. And that's part of the previous question, gender equality. The level of education varies significantly between genders, and improving education, improving opportunities, that helps to reduce child mortality, and that can also will eventually will drive the health outcomes, the positive health outcomes that we want. So if I can invest, education probably will be the most important. Second to that will be accessibility, transport, access to internet, access to other services that involve accessibility to health. Potentially, that will be my second step. But the first one will be education.
All right. Well, definitely, that's something at Thrive that we're all about. A lot of our work is around research and educating the public in general, wherever they happen to be around the world. And it's, as you said, the first step. We want to empower people to be able to make better decisions for themselves. Yeah, exactly. Rather than, as you said in one of your slides, we're not here to tell people what to do or what to think. We're here to share the science and share, a message that gives them the ability to get into a better position or a better situation. So educating the public so they can make better decisions for themselves. So very much on the same page there. Thanks for that. Um, okay. What have I got here? All right, we'll go to this one here. Really on the subject of education, because I know you're a lecturer. I'm a lecturer as well at one of the universities. I know you're the subject coordinator for global and environmental health issues at Torrens University in particular. Thus, in supporting the dissemination of education and being an educator among sort of newer cohorts of students, uh, if I make the question as follows, for say young healthcare professionals who are interested in this field, what do you think are the sort of skills or mindset that you believe are sort of say most important as a young healthcare professional, soon to be healthcare professional, so targeted towards a student in your cohort?
Thank you, Marcia. Great question. Yeah, I some of the things that I always try to teach to my students is uh, look at the evidence, the scientific evidence, as the probably the foundation of what we are going to do, and using that evidence to create realistic solutions, not to try to change everything. Of course, as I mentioned in my class of climate change, for example, the ideal scenario it will be to stop carbon emissions, but at the moment we don't have the technology. So what we can educate and we can achieve is actually reduce the carbon emissions per capita rather than country emissions. And eventually, with improvement in technologies in renewable energy, we will achieve a point where we will rely less on fossil fuels. But for example, if you can encourage people to take the public transport when it's available, to reduce their own carbon footprint, that is the type of strategies that I think are more effective and are evidence based, of course, reducing the food waste as well. Uh, and that type of education is what I want to encourage, to always use the evidence base knowledge, but also think realistically, not think of solutions that in some cases we don't have the technology or the capabilities to implement.
Yes, indeed. We know of a number of, I guess, particularly politicians who like to talk about solutions based on technologies that don't yet exist. And although it's great things to aspire about, but the thing is, we cannot count on those things. This is why we talk about things like precautionary principle and these sort of ideas. We're making sure that we tread on based on what we actually know um, is is steady, that we know is possible to do, and not just count on things that we actually don't have any evidence that we've actually sorted out as of yet, until that time comes, that then we can count it in. But yes, I'd like to look a little bit at your research work. I know your PhD research was in finding early hidden signs of heart disease, thereby sort of helping doctors predict or even prevent heart attacks before they occurred. Looking ahead, what innovations or even partnerships give you the most hope for reducing health inequities globally? So, research-based innovations or partnerships, they give you the most hope, I guess, in tackling some of these health inequities that we face as a species globally, really.
Thank you very much. I think research representation is one of the things that give me hope. How research has improved, particularly in Latin America. When I was a student, most of the information that we have was coming from particularly United States, but many other areas around the world. And today, I've seen that many countries in Latin America are actually increasing the funding for research. And for example, one of my studies when I was doing my PhD, it was actually to use technology to improve a predictive value of risk predictor scores that are used by physicians across the world to know what's the risk level or approximate risk level of a patient of suffering a myocardial infarction or a stroke. But they use tools that were developed for specific populations, the US population, the UK population, and not counting things like uh, uh, native diet, for example, or the lifestyles of different countries and within different countries, different regions. And what I found is that now there are countries that are building these own um, scores based on their uh, population characteristics. So I think that's important in terms of reach that equity on reducing the burden of cardiovascular diseases. The same is happening with diabetes and even with other conditions like different type of cancers. So that's something that give me hope. Research to find these type of strategies and yeah and share, and the share of data has also increased, the share of evidence. That's something that also have seen, particularly after COVID, how different institutions are now more open to share their fundings even before the publications. So I think that's something also that gives hopes.
Hmm. Okay. Um, sounds sounds good. So just sort of tacking on to that. Uh, so, what are some of, like, overall, what would you say are some of the best ways to tackle and support rural healthcare systems over the longer term, I guess? What are some of the best ways to support them?
Well, actually, one of the examples that I would like to see if can be replicated in other countries, especially in low-income countries, is the actual system in Australia, the Aboriginal Community Control Healthcare System. I think that's excellent strategy to have a kind of autonomous system targeting a particular population group, but based on actually their needs and their cultural identity. So if that could be replicated, I feel that that's going to be a significant change in rural areas because rural areas, in at least in Latin America, but I imagine happens in Africa and Asia as well. You have all of these different indigenous communities that are the core of the population, and probably giving a system that acknowledges that diversity and culture, such as the Aboriginal Community Control Healthcare System in Australia, that I think it's probably one of the potential uh, good strategies that could be implemented.
Okay. Just looking at how we're doing with time here. There's actually maybe we could slip in one more question or so. Um, Over your career, have you noticed any major changes in terms of health issues, barriers or outcomes, or something else? So I guess going to a trend or a pattern here. Um, yeah, if so, could you share with us or discuss with us about that?
Okay, so what I've seen, uh, one of the negative outcomes that are unfortunately it's becoming, I will say global, is the double burden of disease, where you have, when you look at countries like Australia and other developed countries, the struggler is more with chronic non-communicable diseases, mental health issues. And we think that underdeveloped or low income countries are just striving with infectious diseases, communicable disease. But there is this hidden growth of non communicable diseases that are becoming a major problem there. And yes, diabetes, cardiovascular diseases, they were always a concern. But now mental health is becoming a very significant issue. And the problem with mental health is the stigmatization that it has. It hasn't been erased like in other countries. In Australia, you can see people talk about mental health. They like to open, communicate, share, uh, engage with the different support services that organization offers. But in at least in Latin America, it's a taboo sometimes to talk about mental health, um, and I think that's one of the challenges that probably will continue to grow because we still are dealing with communicable diseases, but we have this growing concern of non-communicable diseases that, of course, will have a significant impact unless it's recognized and addressed as soon as possible.
All right, thanks for that. I think we're running up for time. There are still some questions that are coming in, but for all those listening in, we will be recording these questions and passing it on to our uh, guest this evening, Dr. Azcui, who will be uh, kind enough, hopefully, to respond to these, and we'll be publishing those. So if you still have questions, you can still share it with us and we can follow up with this in due course. But we're coming towards the end of our time here. So I'd just like to thank you all for your insightful questions and of course answers from Dr. Zkui here.